Can a child get fifth disease twice? Have you ever wondered if a child can catch fifth disease more than once? Fifth disease, also called erythema infectiosum or slap-cheek disease, is caused by a virus called human parvovirus B19. It's a common illness in children that usually isn't serious. It often starts with cold-like symptoms and then develops a bright red rash on the cheeks and sometimes on the body. The rash can come and go over several weeks, especially if the child is exposed to sunlight or gets hot or cold. Most children who have fifth disease develop immunity after their first infection. This means their immune system remembers the virus and protects them from getting it again. Once the body makes antibodies to fight the virus, the chance of catching fifth disease again is very low. Medical experts agree that in most cases, children are immune for life after their first illness. However, in very rare cases, some children might get fifth disease a second time. This could happen if their immune system is weak or if they are exposed to a slightly different strain of the virus. But these situations are uncommon. Usually, if a child shows symptoms again that look like fifth disease, it's not because they caught the virus again. Instead, it might be a recurrence of the rash or skin irritation caused by other factors, like sun exposure or temperature changes. It's important to remember that the immune system's response varies from person to person. Most children only get fifth disease once because their bodies produce enough antibodies to prevent reinfection. If a child does seem to get sick again, it's best to consult a healthcare professional to rule out other causes or illnesses. In summary, the scientific consensus and medical guidelines tell us that children generally do not get fifth disease twice. Once they have had it, they usually develop lifelong immunity. If symptoms reappear, it's more likely related to skin reactions rather than a new infection. Always seek advice from a healthcare provider for personalized medical guidance and to ensure proper care.